Hey everybody, welcome back to Virtual Equity. My name is Lindsay,
And I'm Nicole.
and today we are here with our sixth episode, and we are going to discuss the things that we think our team did over the last year to help them pivot in the new environment of the healthcare travel agency. Again, like most podcast episodes, we have not looked at each other's answers. We find it to be one of our favorite parts of recording is just seeing what the other person thinks. There were toys right there. Anyways, so just to give you a little bit of background about the healthcare travel industry overall, with COVID, we had a huge boom in the industry. It was mass chaos, and so a lot of recruiters came into the industry and started their recruiting career during COVID. But COVID was more of a like you take an order from the candidate and then you had 10 jobs for them because you weren't having to necessarily convince them to go places. They're like, this is where I'm willing to go. And you're like, cool, I have 20 openings for that. Let's take it. And then as the COVID rush kind of ended and things like that shifted, it came back to original recruiting where you had jobs and you have to convince candidates to go to those jobs. That with the hiring increase that we did through COVID, a lot of your newer recruiters did not have previous recruiting experience. They only had what occurred in the industry. And then as the like craziness of COVID ended for like all other industries, it actually created even more chaos in the healthcare travel industry. And so we had things like we had a large number of healthcare workers move into travel and then move out of travel. So most of us had list and database and candidate groupings that included thousands of people who were no longer willing to travel, and you had to weed through what used to be like 200 travelers to find your 200, a list of 200 people and find your travelers. It was like a list of 2,000 people to find a handful of travelers, right? So it was taking them more time. They were having to learn to like talk differently. Through COVID, a lot of things were automated, a lot of things were text message, like you barely got on the phone, everybody was busy, it was chaotic. And then as the industry came out of that, it was like you got to pick up the phone, you have to have conversations. People don't want text messaging all the time. So there was those kind of things. And then we had like the bill rate craziness, right? Through COVID, bill rate shot up, pay rate shot up. That came down, and there was a push and pull in the industry between travelers being like, I expect to be paid this, and hospitals being like, well, we can't pay that anymore. And then with the whole need for travelers, right? Like there were all these open recs, and the requisitions were no longer open, right? Instead of needing travelers, they were able to bring perm people back on. People started signing back on to stay within float pools. I don't know, Nicole, do you have anything else that kind of like shook us over the last 18 to 12 months that's just been like we had to learn to overcome?
I mean, I think for me it was a little bit different when I came on to kind of our role. So even though I have several years of recruiting experience, I came in towards the end of COVID, I think. And so we were kind of already, I think we are still a little bit in the middle of it, but already starting to change. I was actually in a HR compliance manager role during COVID. So my experience of that was I was the crazy person in the background doing like the policies, writing the letters and, negotiating different things. And I was also in a role where it was more general industry, but same. A lot of, I would say I had probably 200 to 300 people that were in more of a manufacturing distribution environment. So what we were doing at the end of COVID was what I've always done for recruitment. Like I've never been in a situation recruiting where I'm like, I have so many candidates to call from. It's like I have so much time on my hands. So I feel like what the healthcare industry experienced in staffing is what staffing has always been for me. So that I've never experienced a time in staffing where it was just like we had a plethora of people and we were like, this is so easy. So yeah, I think that's my kind of take on it. That's how, yeah.
Do you think the lack of other recruiting experience probably hindered some of the newer guys coming into our industry? I mean, based on like your experience. I mean, you had a very unique experience with us because we were coming out of COVID.
So do I feel like new recruiters would struggle like in the healthcare
I
or
guess, yeah, like if you were new and you came only into COVID and then like coming out of COVID, right? Like, do you see that they struggle?
I think it would have been a really big struggle. I mean, I think it would have been a difference for me just because it was I think it's hard. Like I think with recruiting, there's always kind of this life cycle in recruiting, right? It's pretty standard, but I think it with COVID, I think that kind of changed a little bit, right? And it probably removed several steps from the actual like recruiting life cycle. So if you were coming in and you had prior industry experience, you were trying to translate that into the healthcare, but healthcare was not truly healthcare recruiting because it was COVID healthcare recruiting. So it was like, let me apply my skill sets that I have into recruiting, but you're not really recruiting. You're just kind of like, so I think it was I feel like it's one of those things like you were either, it's like one of those when people tell you like you had to be there. And I do feel like it was very much like you had to be there to get it. And so like I, for a period of time, felt very much that like outside looking in because I'm just like, what is this shit show? Like, what is happening? And what are these rates? Like the rates that I was seeing, I'm like, I could never like, and so yeah, so I think that if you had prior experience, non-healthcare related, it would have definitely been really hard to like come in towards the end of COVID because I think that if you were recruiting in the middle of it, then that's when you kind of had to have capitalized on making those connections with your travelers and being able to kind of coach them and carry them in through the post COVID era type of thing. Um, so yeah, it definitely seemed like a very wild ride.
It was. It definitely was. It was crazy. So I mean, you will know this, but so over the last year, as a whole, like our team and our company, we've all had to reshift how we're doing things. And it's been really interesting. Like, I don't want to use the word like re-educating because that's not really what you're doing, but just like having to have sometimes difficult conversations with candidates about the changes that have happened and listening to them be like, well, it used to be like this during COVID. And you're like, yes, we understand it. And like having to explain that, having that hard conversation, listening to those people yelling at you, like all of those things. It's definitely taken a toll over the last year. And I know like as a team, like they've had to, famous words, had to pivot, had to change, had to implement quickly a lot of different changes to help stabilize their desks, right? And so the topic today is three things that we think each of us, because we wrote different lists, think that our team did that helped them become successful for this year. Because as you know, everybody's numbers are increasing. They all can confidently run on their own. They're doing great with building relationships and having conversations and quickly adjusting to objections, which has been a huge changer for them. And it's like, I mean, I feel like they confidently can work over objections, especially some of those like pay objection, location objections that they work so hard on. So, what are three things that you think that the team has done really well to help them pivot and prepare for success this year? So you want to
So,
start with your list?
yeah, I can start. I feel like I always start. Um, I think the main thing that I think honestly anyone in recruiting after that time period is just being able to adapt, right? And we've talked about in previous episodes about what we think makes a great recruiter. And I think we've talked about adaptability. And I think that has been a big, just a huge thing for us in terms of being able to adapt to, are we working specific specialties? Are we working in specific locations? Are we niching down? Are we and really, as a recruiter, it's like adapting to being able to be more strategic and being able to also recognize the data that's in front of you. A lot of times now, it's like I look at our our systems and our database. And I'm like, we have so much data available to us and in front of us. So it's, I think, been working, with a team. And I would tell this to any recruiter in any industry. It's being able to look at your desk, look at your people, look at your clients, be able to look at the information you have in front of you and kind of be able to put that together into seeing where are your trends, what's either trending down, what's trending up, where do you think, and start building a forecast. I think forecasting and recruiting is so important. I think that really has helped us prepare for this year already.
And it's funny you should say that because your one answer literally were my like encompassed all three of mine. So mine are definitely going to be a little more analytical, probably due to the fact that I'm the operations manager, right? Like operations is like what I have to do. And I know that for us and being able to really get a handle on what is happening, who is coming off, who is staying, who is going, where are they going, things like that we as a team had to go, what are we actually measuring? What do these numbers actually mean? And not only that, but like how does that help us? What am I supposed to do with these numbers? So we've been measuring numbers and we've been comparing numbers, but I mean, I feel like as a team we had to step back and say, "Cool, I love that we have all this information, but what does that mean? How are we going to use this to make better decisions? How are we going to use this to predict the future? How are we going to use this to stop the bleed and look towards the future and plan for the future?" And I feel like as a team, that has been one of the biggest game changers for us is just getting a handle on what we're measuring, why we're measuring it, and how to make those numbers move in a way that we want them to move, right? And it literally took the entire team rallying behind plans, right? And talking to them and seeing what they're experiencing. What does that look like in the numbers? Can we see those trends? How do we make those needles move? And I feel like, we always measured things, but they were so like step back a little, right? Because in the middle of COVID, you had large numbers. It was crazy chaos, not a lot of time. And it was like you're just kind of skimming over the top of it. And then when things started shifting and changing, you had to be like, okay, now let's dive into why it's happening, where it's happening, what can we do to make that different? And so I feel like as an operation analytical person, one of the greatest things we did was learning to measure what we need to, why we need to, and then like talking about it as a team on how to move that in one direction or another. For sure. So the first one I gave you lined up, literally you said all three of mine. Mine are very, very specific. They are not general. They are very analytically specific things, probably to do with my role currently.
Obviously, always more general. I think in my answers, I think honestly, and in terms of that adaptability piece, and even in what you're saying, it's the being able to go from the instant gratification in the quick wins to learning how to play the long game, right? So it's like it's easy to say it's like let's analyze the data, let's see what pushes, what moves the needle, but you can't just sit there and like watch it. Like you have to be willing to be like, this is going to take time. And anytime that you adapt, that you make a shift, that you decide to take a risk, it's one of those things where I feel like sometimes in recruiting, we're so used to the quick, fast wins. And especially I feel like with healthcare, it's become more of the what is this going to look like in the next couple of months versus what is this going to look like right now, next week. It's you have to start playing that long game. It's like what you do today is going to set you up for the next month, the next 3 months, the next 6 months. And so I really think that what you're talking about in terms of like the very, very specific things are all the little things that you have to do in order to be able to like big picture, then kind of step back and be like, oh, look what I did. And it's like, but that took freaking 4 months versus a week, which it usually took.
Yeah. And it is, that is not actually on my list, right? The shifting from the instant gratification to the further, like looking out to the future and planning for the future. Like Pre-COVID, that was definitely the way things worked. In the middle of COVID, like things changed and happened so rapidly. Like facilities were coming to you and they're like, I needed 100 people like last week. They're like, they were waiving credentialing. They're like, if they can take a drug test on site, like whatever, that's fine. Like we don't need anything from them. I'm like, nothing. And they're like, nothing. It was so crazy that instant gratification was definitely reinforced, right? Like I can make 10 phone calls and I've got five people ready to go and I've got 100 places to submit them to. And so I'm going to win. Like the statistically speaking, I'm going to win. Um, and having to switch out of that, not only in recruiting, but looking at metrics, moving numbers, looking at all of those things was definitely different. Even down to like having travelers stay with us long term, right? Like through COVID, it was like they were just hopping on the money train, and I do not blame anybody for that, right? Like I totally get that. If I was a traveler, I would be making as much money during that time frame as I could have. Totally get that. But as an agency, it's like we're not retaining people; they're just bouncing all over the place, and we couldn't measure like how long are people really staying with us because they might take a contract and they're going somewhere else, and it was definitely crazy. And to see us like put in the time with travelers and see them come back and then see them come back again and watching that trend over time instead of it being like chasing things all the time. Like I know that didn't quite make sense, but I'm just saying like it's interesting the whole instant gratification because it was traveler, but even with like your numbers and stuff like that, it's like, oh, I have 100 travelers, but like I'm always having 100 travelers because I can't build relationships with them. And so when we were, it was like, wow, this traveler, I have 10, 15 travelers who stayed with me all year long. Like they didn't leave. Like I have a relationship. I know what they're doing. I know who they're marrying. I know what their kids are like. I know who's having grandbabies and where their grandbabies are being born at and like all of those things. And so I think the team got to take a step back this past year and really get to see that and really get to connect and really get to know their travelers as well. Pushing past that instant gratification. That was just a random tangent there. So
No, I think it goes in, like as you were talking, like it makes me think of it, right, from a recruiting aspect. And I think part of what makes a good recruiting team is also being able to kind of recognize the trends within people. And so to me, it's like, yes, there was a lot of money happening, but there was also a kind of a call to action to like any kind of healthcare professional. And I'm sure that part of it is like, yes, I want to be there. I want to be in action. I want to be there helping out the communities. I want to be there helping out patients. And now you're kind of dealing with the fatigue piece of it, right? It's like, I did my part. I was there. I wore those freaking masks. I was the one that was scared that I was infected with something, or, I watched a lot of people pass away. So it's like, not only, I think the industry as a whole is dealing with the aftermath of the people aspect of it, right? Not only is it, yeah, its rates are much lower, but it's people are tired and they saw a lot of stuff that they're probably still working through. So now you're kind of regrouping, right? And you're looking for those people that it's like, okay, you've had kind of that time frame to figure out what's your next steps. And I know one of the things we talk about a lot is you have to go back and find the people who are truly in it because they're passionate about exploring, passionate about something new. Or maybe it's not even that you're passionate about traveling, but you have a short attention span and you only like to deal with a certain group of people for a certain amount of time. And then you're like, I'm ready to go somewhere else, right? Um, so like, when you're talking about it, it's like that. I feel like there was a lot of people that would have answered the call during that time frame. And now they're kind of like, I want something more secure. And so they're steering away from travel. But I'm like, the way I see it too is like it's an ability, like you have the ability to find adventure and kind of fall in love again with your profession if you take those travel assignments because you're getting to experience it at different locations. And maybe you got tired at one place, but now you have the ability to go all over the country. I mean, I sometimes I sit back, I'm like, why didn't I go to nursing school? Like, why am I not a traveler? I could be in Hawaii right now, enjoying like working 3 shifts and then being like, cool, I'm gonna go island hopping. I don't know. That's my turn of thought every time. I definitely get the FOMO when I talk to some of our travelers or when I hear like what they're doing, seeing their pictures. I'm like, why didn't I go to school for that?
all right, what's the second one on your list?
Actually, mine kind of goes into what you talked about, and it was I had strengthening relationships and being able to nurture relationships. So I think definitely the team and just overall, we had to shift our communication. We had to become more proactive in our communication. We had to make sure that we were also personalizing the communication, right? I think right now people do have a little bit of fatigue with the, I've used that word now like 3, 4 times, but like that fatigue with the AI, with the automation, right? So it's kind of, let's go back to kind of the core things, like what sets us apart, what sets you apart as a recruiter, why do people want to travel with you, and being able to put that into a conversation. And it might just be setting up those flows that we set up, but it's sharing that piece of you that is going to make people interested in at least taking a phone call and having a conversation with you. So that's my second one.
So I'll just go to my third one because it aligns, right? So like you say something and I'm like, yes. And now here's the exact detail of that, which is so funny because I'm not a detail person, right? But it's the analytical piece of me. Um, Having a better follow-up process. We all know that recruiting requires follow-up, right? Like everybody knows that. But if you started with COVID, or even if you didn't and you just spent the last couple of years in the COVID environment, you may have lost the finesse of what follow up means for you. And so that was the one thing that the team, I feel like, well, not the one thing, is one of the things that the team has really, really worked on is the way that they're following up, not just instant follow up and say we have a job that we're trying to find candidates for, but the follow up process over time and the building relationship. What is that? What does building relationship look like to you when you're following up and you're having those conversations? But like really, really, really focusing on what is your follow up plan. And I feel like that was something that it took a little bit of time for us to find the right kind of follow-ups in this, like coming out of this industry where it was one thing and now it's another, and just making sure that we're not that we're doing follow-up in the and in the right manners and in the right ways and with real connections, right? I feel like that really was a pivot for the team and just getting back into their flow of follow-up. I mean, I feel like everybody nowadays is like, okay, cool. What's our follow-up plan? What is our objective with this reach out or whatever it is we're doing? And then what is our follow-up plan, right? Like the team's always like, what's the objective? What's the follow-up plan? And just getting better at that. And it's funny because, I sit in boards with other agency owners and I still hear them being like, how do I get my team to do follow-up? And I'm like, oh, our team, our team did an amazing job, like diving into it, practice, not just, I don't want to say practicing because it's not practicing as much as like tweaking and developing their own style of follow up, and the way that they want to do it and making sure that they're following up with candidates and future candidates and things like that. So to me, changing their follow up and really honing in on their follow up process has been a huge changer for them, especially when they pull in why you want to work with me as your recruiter. Having those actual conversations, not using technology to replace their outreach, but using technology to support their outreaches. Things like that. I think that they and us as a team have just done really, really good at like really honing in on that and working that, right? Like if it didn't work, coming together and being like, what can we do to make this work? Or I've tried this and it's not working. What do you guys suggest? And oh, this actually worked for me if somebody else wants to try it, and just helping each other and leaning on each other to come up with a better game plan when things weren't working and when things were working. I think that helped the team a lot.
Yeah, for sure. I think it's really important to, I think as a recruiter coming out of that time frame, I think it would have been really important to kind of get back in touch with who you wanted to be as a recruiter and what made you a recruiter. And some people weren't, I think a lot of people were just kind of thrust into being a recruiter, right? And it was like I had no prior experiences and nobody did. So it's, I think recruiting styles is something that are so unique to you, and two recruiters are going to be the same. Um, and that communication piece, how you listen to people, how you talk to them, how you interact with them is your follow-up. A lot of times I get back like, well, I don't want to be annoying. And it's like, well, if you have the right communication, you're not going to be annoying, right? It's like being able to really put your personality out there, because at the end of the day, it's like if they don't answer you or if you get a big F you from someone, then it's like, is that really who you wanted to, to work with, to have that partnership with? And a lot of times the answer would be no, because if someone is so quick to answer it that way to you, then is that someone you really want to put bedside, right? That's kind of the way I always used to think about it. And I think it's that removing that fear piece from the recruiting of being annoying. Like, oh, I don't want to call this person and get hung up on. It's like we get rejected a million times a day. We just have to be able, like, okay, well, great talking to you, not, and move on to the next person, and not being, not being shy. I think you can't be shy if you if you want to recruit.
I
Uh,
think, oh, go ahead.
no, go ahead.
I was going to say, I think even with follow up, that goes hand in hand with like overcoming the objections. Because when you have a really strong follow up process, you have you get exposed to so many objections that you can put in your arsenal of how to overcome them, right? But when you have a strong follow up, when you hit an objection, that doesn't stop you because you already have your path to your next part of the follow up process, right? And I feel like that's just really really important to keep moving forward like you said, and not to get hung up on the no, and not to get hung up on this and that, because you're still moving the needle, the conversation forward, depending on where it's happening and what it's doing. But if you didn't have a game plan to start out with your follow-up, like you just kind of were like in la la land or like left field and being like, I don't know what to do, like running around being like, I don't know. It just really really helped as a whole us just kind of move in the right direction, and the team not feeling so freaked out all the time about getting the no's, I feel like. So
Was that your
that was still part of my second one.
okay? Did you want to do your third, or do you want me to do a third?
You do your third. I want to see if I'm trying to now the question is, because like yours is more general and mine has been like an example, right? I'm curious to see what your third one is
Are
and
we
if I
three
can
for
tie it
three?
and if I can tie it in as an example. Because to me, my next one definitely goes with your first one. So let's see if we can line the third one.
I feel
So
like there's no way you wouldn't be able to tie this, because that's going to be good recruiting, being able to tie it anyway. This one I feel like is super general, but not at the same time. So I put optimization of our overall like approach. So what that means to me, you can tell me what you said, or I can tell you what
no,
I.
no, you go first, and we'll just see
Okay.
if I can line this up properly.
So for me, it was being able to kind of, with the shift, right? And with things changing for people, my big thing was being able to truly explain kind of what we were selling, for a lack of a better word, right? So I don't want, those rates are too low. Okay, well, so how can we pitch these jobs to people and not so much focus on pay rates, but explain to them, the flexibility they have. Talk to them about stipends. Talk to them about how we can write this contract. Talk to them about insurance. Talk to them about XYZ that is not going to just focus on rates, but it's going to encompass a whole thing. I think during the last year or two, we we're able to set up a lot of automation and be able to reduce some of that hands-on time that we spent doing a lot of the back end stuff, and also kind of focused on our administrative pieces that were important. So something as one of the things that I've heard, I've always done drug screens, background checks, all of that. I've never in healthcare, I think it's so funny where it's like a whole credentialing piece, right? Because it has so many moving pieces. So it's like, okay, how are we optimizing our credentialing piece, our compliance piece, so that no one is like, crap, I have to do another, I have to go through another credentialing process. And so I think we spent a lot of time kind of really looking at what we were doing, what we weren't doing, how to facilitate the things that we needed people to do, and how to make it as least cumbersome as possible. And I think that really has helped us out a lot.
So I agree. And so here's that detail piece to it, right? The big thing that we did over the last year was niche down our specialties, niche down our states. By niching down, we were able to better talk about locations and talking about hospitals that we're staffing and talking about what requirements you're going to need in those states and for those specialties and knowing what certs are needed and what certs are not. Because nothing is more complicated or more, I guess more frustrating probably to a traveler and even to the credentialing specialist is chasing a credential that you find out isn't actually required because you didn't know not to ask for it, right? I didn't know that the PALS is not always required for OR, and I've been chasing this nurse down for the PALS for her assignment. Come to find out, had I just asked, like, "Are you sure this is needed?" I'd find out that they didn't need it, or even worse, they already paid for it. Now we're out reimbursing it when it wasn't required because nobody stopped and said, "Hey, is this really needed for this assignment or was that just a mistake?" Which happens quite a bit, right? And so niching down to our states, our specialties allowed us, I feel like, to be a lot better with understanding what compliance is needed in the background and making it, giving us the opportunity to find out where we are lacking in our credentialing and the communication and credentialing and setting up better automation surrounded around states, specialties, and things like that. So I agree. Niching down and really honing in on our market and who we're talking to, where we're talking to, and what we're talking about has really helped us improve overall processes, overall administration stuff, and just the experience that somebody might have working with us. Whereas before, we, especially through COVID, like there were such high needs everywhere for everything that you literally just dove in trying to get people places so that facilities could function, especially like when it was like mass numbers of people. And there were plenty of times like that we didn't necessarily know all the ins and outs and we're like trying to research and learn, and like a lot of times the travelers were giving us the information because it was just happening and changing so fast. And so then we got to take a step back and be like, where do we do really well at? Who do we know very well? What areas do we like? What specialties are we great at? Those sorts of things. I think really made a difference for us and being able to work a lot smarter and not a lot harder on things, and just being able to be better communicators and knowing the needs of those that we're talking to for sure.
No,
So
I
look, they
totally agree.
aligned.
Yeah, I think that's why I like to we did talk before this and we're like, wait, are we gonna come in as a united front or are we just gonna be like I like I always feel like I'm very much like, okay, this is in general what I want. You're much more detailed. So I guess I like that we can complement that.
Yeah, it's definitely because it's definitely interesting because it's two different points of view, right? Like as operations, like mine is definitely like what exact changes did we make? Whereas you're like, this was the goal, and I'm like, these are the changes we made to hit that goal. So that was I'm glad we decided to do it this way because this is my favorite way of doing it for sure. So you know what we did not do before this? So I'm going to put you on the
What we
spot and you're
never
going to
do.
have, yeah, but so you're going to have to do this on the spot. What would be your recruiter tip of the week?
Hmm. Guess my recruiter tip. I'm trying to think. What did we talk about this week? I think honestly, it kind of ties back into what we've been talking about during this episode, but it's I think probably find out what kind of recruiter you want to be. You know, find out what recruiter you want to be. Think about what's going to be able to appeal to the people that you're trying to engage. And one of the things that I found really interesting is that for recruiters, for people who sell, it's really hard to sell ourselves sometimes, right? So it's figure out what makes you you, what makes you unique, why you want, why you think people should be working with you, and also skill market yourself. Start building a network. I think it's so important for us to be able to network, to have conversations, and you never know who you're going to meet, right? Just even at the grocery store, at a coffee shop or something. So it's I said before, it's like you can't be shy and be a recruiter, but it's always, and I'll let you know, I'm probably more of an introvert than an extrovert in general, but that's one of the things that I'm kind of working on. It's being able to just be able to walk up to someone and have a conversation. Because typically I'm the one that's going to be like, I'm going to walk the other way because I don't want to have that conversation. um, to be able to figure out who you want to be, figure out like what your style is going to be, and then skill market that and be able to connect with the right candidates that you're going to be able to place and have them be successful in the roles that they go to.
Yes. I love
Yes.
that. That was a great tip of the week on the spot. Great job. All right. All right, you guys. Thank you so much for listening today. Have a great week.
Bye.